Hello, I'm Cindy Arenberg-Seltzer, President and CEO of the Children's Services Council of Broward County. Welcome to another edition of Future First, Focus on Broward's Children. Access to affordable health care is of vital importance to families, both for preventive care to keep children healthy and for treatment when, God forbid, a child or their parent is ill. In this country, affordable insurance is critical to the receipt of adequate health care. Over the past few months, the implementation of the Affordable Care Act has changed the way individuals and families get health insurance. Today's guests will share information on the changes brought about by the Affordable Care Act, what these changes mean to you, and guidance on how to find insurance in this marketplace. Here to discuss the issues are Nicholas Duran, State Director of Enroll America, Magaly Prezeau, CEO, Executive Director of the Community Access Center, Adrian Madriz of the Epilepsy Foundation of Florida, and Lisa Agate, Program Manager with the Broward Regional Health Planning Council. Thank you all for being here. Let's start with the big picture of the changes being brought about by the Affordable Care Act that affect the majority of the population. This really is a change. We've all been used to for years getting our health care through our employer if we're lucky enough to be employed by someone who provides health insurance, and anybody else was on their own. It's a new day. So, Nick, your life has been devoted to getting people enrolled now. Tell us about why they should get enrolled and what it means to them.
Sure. So it's a new day, as you mentioned. There is a new health insurance marketplace in the state of Florida. And people can go to this marketplace and explore what new affordable quality coverage options are available to them. Many of the important things that have changed are, one, if you have pre-existing conditions, if you have suffered, if you had a knee surgery, or if you've had asthma and you've suffered from asthma, you're not going to be denied coverage because of those sorts of issues. You're also not going to have a plan that's priced based on having those issues. So pre-existing conditions no longer can impact your ability to get insurance or how expensive that insurance is going to be.
So my husband, who is self-employed, a long time with a very small business, there's only 4 full-time employees, so they're not able to negotiate anything, and he has bad asthma and allergies and all kinds of chronic conditions that had his insurance in the thousands of dollars. What can you do for him? How can you help him?
Well, he owns his own business, correct?
He does.
Yes. He may actually benefit from getting marketplace coverage from the Small Business Health Options Program, which the acronym for is SHOP. SHOP. So because he's a small business owner, there's a special marketplace of plans available to him that he can offer to his company and to himself that will qualify for a different set of subsidies than the individual marketplace would qualify him for. So actually it depends if he wants to go that route, if he wants to enroll in coverage that he'd like to be able to offer his company and the rest of his employees. Or if he just is looking for coverage for himself and he really just wants to get that taken care of first before he worries about the rest of his company. But he actually has a few options available to him.
Very good, because I'm sure he's not alone out there.
And prevention is so important because a lot of times people will wait till they present to an emergency room, and I think that being able to do early screenings is really vital to having something not turn into a chronic health issue where they end up in an emergency room. So it's important to know that these screenings are available through the Affordable Care Act now.
And we know that many people have let those things go by the wayside. They haven't gotten that because they're afraid of the bill. Why would I get a pap smear? I can't afford to pay my doctor for that. Right. I can't afford to pay the doctor visit. I can't afford the test. Maybe I won't get that x-ray or that mammogram. Sure. Of course, I'm thinking of the women's side, but you men have preventive things you need to do as well.
Yeah, absolutely true.
I think Lisa brought up a very good point, and one of the other major changes with the marketplace is that there are 10 essential benefits that need to be, that are a part of every single plan that's being sold in the marketplace. So if you went to healthcare.gov today, and you went to all of these different plans and started looking at what options are available to you, each of those plans will have these essential coverage options that include emergency care. When you have to present to the emergency room, you're going to get coverage. There is coverage there for you there. For preventative care, doctor's visits, those sorts of things are available, part of that. You also have mental health care that's a part of the plans now that was never a part before. Being a woman no longer before that was a pre-existing condition.
Yeah.
But women have those preventative care opportunities that are going to be a part of every single plan that they're taking a look at.
I think one of the things that may scare people, at least as I hear about it, is they go, I don't know, I don't understand. There's all these options now and there's all these things. I don't understand what it means because they never had to shop for insurance before. Either you were lucky enough to have an employer who said, here, this is the health plan you have, take it or leave it, or they said, well, I can't get it. I mean, maybe if you worked through a broker and found insurance, and now they're actually looking at all of these differences in plans and realizing just how confusing it is, because it is confusing. Sure. You have deductibles, you have co-pays, you have things that are covered, things that are not covered. Who wants to tackle the little guidance for what to look for when you're looking at this marketplace?
Well, the certified application counselors, they work a lot in educating the community. Especially in the community like in Broward County where you have families from different backgrounds, diversities, and languages. So to try to even explain all those details, especially to the immigrant population that maybe has never had any insurance. And now you have to explain deductibles and premiums. And there was a lot of confusion because people thought this was free insurance. So when they come and apply and they find out that they now have a premium, they didn't understand the difference between free insurance and affordable care insurance. So there's a lot of education involved. And when you have people with immigration status, there's also the fear, especially if they're in the process of getting a green card or citizenship, they're afraid that if they get Medicaid, that would prevent them from getting their status. So we have to do a lot of education saying that it does not matter if you have Medicaid. It doesn't affect your status. And also immigration doesn't check. There's no connection between the Health Care Affordable Care Act and immigration. So somebody who's undocumented can actually apply if their children are U.S. born, and it would not impact their immigration status.
Speaking of their children, there's another program that has existed in this state for years, Kid Care. And there has been, I know, a little confusion. Some people who are not familiar with Florida don't realize that S-CHIP, or that CHIP, the Children's Health Insurance Plan, that's what it's called at the federal level. At the state, it's S-CHIP. In Florida is Kid Care. So Kid Care is insurance that exists today that you can get discounted or you can pay full freight for, and is available year-round. Lisa, do you want to speak about that?
Absolutely. Oftentimes you find parents who will make sure their children are covered and sometimes not themselves. And so we've had a lot of families come in and they're more concerned about their children. And so we just want to make sure that people also know that it's available beyond the marketplace, which enrollment ends March 31st, but that Florida Kid Care or the state CHIP program is all year long like Medicaid. They can apply beyond the March 31st date. But it's vital. It's also screenings for children, it's immunizations, and it's just very important for them to know that they may be eligible for that as well.
And you can get that, they can look up that number, we'll post it on the show. Right. Your children need to be covered regardless of what happens to you.
Absolutely. And 211 too, because they'll also be able to give the number out as well.
Great tip. We always love sending people to 211.
Right.
We'll get you whatever services you need to have.
I would say, that with the marketplace, you do have the opportunity when you do go and sit down with Lisa, or you go and sit down with Adrian. When you begin that application, it's going to ask you about your children. And so while you are looking into the options of your family, yourself and your family, you will have the opportunity to go down the path of figuring out if Kid Care is the right program for you. So it is a part of the plan as well. And one of the other important things I think that what's great here about the marketplace now is that there is in-person assistance, trained assisters who have gone through a federal training, who understand and can provide the navigating someone through an application. So Adrian and Lisa, they've all had this opportunity. The certified application counselors, we were talking about them. These are all folks who are in your community, who are trained to provide you with assistance on knowing how to apply and go through the application and considering what is the best policy or plan for me, what fits my lifestyle, what fits my budget.
And talk a little bit about those navigators, because there's been a lot swirling that, you know, we can't trust them, they haven't been screened, these are dangerous, scary people. You look like dangerous and scary people.
I promise I'm not all that dangerous.
Can you all talk a little bit about the training you had and the screening and background and all of that?
Absolutely. Navigators are a special breed of individuals that have to undergo a 20-hour training, which is provided by the Department of Health and Human Services. And then the state of Florida has additional requirements that these candidates have to go through before they can actually become navigators. And that includes a very intensive background check and also licensing through the Florida Department of Financial Services. Okay. We have to pay for that background check and that licensing, so it is a commitment that folks are making if they decide that they want to become navigators. And once they do become navigators, they get a license that they then have to carry around with them wherever they go, whenever they're actually providing assistance, so that consumers are aware that this is a trusted individual to whom they can consult for any of the information that they might need regarding the Affordable Care Act or the health insurance marketplace. We are very diligent about making sure we set the highest professional standards available about labeling ourselves. We always wear our shirts so that people know that they are talking to a representative from the Epilepsy Foundation of Florida. I don't have my badge with me right now, but we also have a badge that we wear around our neck that has our license both from the Department of Health and Human Services and the Florida Department of Financial Services. So if anybody has any doubts whatsoever about the person that they're looking to consult for the assistance, they should ask them to present their license, because it's something that they're supposed to carry with them at all times. And if for whatever reason they're consulting an organization that doesn't have the license or isn't properly branding itself, they should really be aware of their surroundings, and they should be aware of who it is that they're talking to, because there are some organizations and there are certain individuals out there that have very nefarious intents about what they would like to do with folks' personal information, and also what they would like to do with their money. And if anybody's charging for this service, that's a big red flag. Okay, these are services that we are supposed to be providing for free to the public as a service. Okay, no one can charge to get assistance with the Affordable Care Act.
And should you have access, if they do speak to one of you and they get this navigation help and they want to sign up, is there any reason for you to have their credit card information or anything like that? I know you have to plug in some financial details, obviously, to figure out if they qualify for subsidies and what. But do they pay through you for the...
The payment does not go through a navigator or consumer assister. However, folks do have the option of tendering payment once they've actually submitted the application and selected a plan, but that information never has to actually go through the navigator. A person can directly input that information into the computer, and it goes directly to the insurance company. Okay, we're very, very, very well trained on how to handle personal information. We take a separate training just on how to handle personal information at the Epilepsy Foundation of Florida. We follow all the strictest HIPAA standards that all of our medical practitioners also have to provide in our offices. And so we're very well aware of how to handle that kind of information. And people should be absolutely confident that when they deal with an organization like ours, that they're getting the highest professional quality of care.